Distal radius are one of the most common fractures. Some of the traditional treatment methods used are to revolutionize the way distal radius fractures are treated, Zimmer Biomet now introduces the world-trusted technology in India, presenting DVR Anatomy. The only volar plate designed for both dorsal and volar fractures. What do we want in distal radius plating system? Let's see how anatomic restoration of the distal radius gets possible through DVR features. Now introducing the world's trusted plating system in India for managing the distal radius fractures. The DVR Anatomic, with unique and proprietary features like anatomic design, fast guide inserts, proprietary peg distribution, referencing K-wires for provisional fixation, patented double-tiered peg support of entire articular surface, distal peg row to support volar aspect of subchondral plate, proximal peg row to support dorsal aspect of subchondral plate, distal K-wire holes for temporary fixation and plate alignment to distal fragment, proximal K-wire holes for temporary fixation to proximal fragment. Let's look at the uniqueness in anatomic design of the DVR. The distal geometry of the DVR Anatomic is contoured for placement 2 to 3 mm proximal to watershed line, most distal volar margin of radius, which minimizes risk of flexor tendon contact and irritation. Let's look at the uniqueness of fixed angle K-wire system of the DVR. The fixed angle K-wires allows for provisional plate placement, maintains reduction, predicts peg distribution, allows to assess peg placement prior to drilling, helps align for appropriate peg distribution. Now looking at one of the most differentiated feature of the DVR, the proprietary peg distribution with tangential subchondral support. The DVR Anatomic has a patented proprietary peg distribution design. It provides the much essential tangential subchondral support. The DVR Anatomic comes with the fast guide inserts for fixed angle screw targeting. And the key feature which makes it the mother of all distal radius plates, MDTP, the multi-directional threaded peg. What is a multi-directional threaded peg? How does it work? The MDTP makes the DVRA a hybrid of fixed angle plates and variable angle plates. Now we will take you through the visual representation of the DVR anatomic design.
Following animation demonstrates design rationale and key product features for the Hand Innovations DVR anatomic plating system. The watershed line is the primary landmark that is used to determine the distal plate positioning. The plate should be just proximal to the watershed line in order to reduce the risk of soft tissue irritation. To identify the watershed line, palpate the radius distally to identify the volar rim of the lunate fossa. Notice that with the plate just proximal to the watershed line, the tendons remain protected from the risk of plate contact. The DVR anatomic plates incorporate fixed angle K-wire holes for provisional plate positioning to aid in the reduction of the distal fragments and allow you to assess the correct peg placement prior to drilling. The intermediate fibrous zone is a 1 centimeter band of fibrous tissue located between the watershed line and the pronator quadratus muscle. The IFZ should be elevated together with the pronator quadratus in order to fully visualize the fracture. After final reduction has been obtained through indirect means using the DVR anatomic as a template, secure the distal fragment using a K-wire through the hole on the ulnar side of the proximal row. A second K-wire can be used on the radial side of the proximal row when extensive comminution is evident. Confirm proper reduction and placement of the K-wire 2 to 3 millimeters proximal to the subchondral plate using fluoroscopy and 20 degrees elevated lateral views. The DVR anatomic optimized radial styloid peg angle helps to capture and support radial styloid fragments. Intersecting proximal and distal rows from a patented three-dimensional scaffold, providing optimal support of the articulating surfaces. Locking pegs and screws provide the strongest peg-to-plate interface. The use of threaded pegs will help to capture dorsal comminuted fragments. The DVR anatomic incorporates preloaded single-use drill guides that are calibrated to the optimal angles, allowing you to accurately place all the pegs and screws without obstructing your view of the fracture site. Apply the plate to the volar surface of the radius and position distally to align the plate to the watershed line. Insert a K-wire into the hole on the ulnar side on the proximal peg row and bend it out of the way to facilitate drilling. Drill through the preloaded single-use fast guide using the 2 millimeter fast drill bit. Insert the fast peg driver into the fast guide until fully seated, and then turn in a counterclockwise motion to remove. Dispose of the fast guide after removal, as they are intended for single use. Measure the correct depth for each of the pegs before or after removal of the fast guides using the proper scale on the fast bone depth gauge. Insert each of the pegs using the same fast peg driver until fully seated into the plate. After the first screw has been placed, all other holes can be drilled, measured, and inserted at once. Please be sure to remove all fast guides prior to closing the wound.